So general practice has been transformed during the past 70 years from a very small cottage industry to a very large business providing care close to home for millions of people. In fact, over 1 million people see their GP every single day. So we're a very busy business. The number of GPs has risen drastically over the years, but the amount that we can do for people has risen drastically. We've got far more that we can do for people, whether that's testing, diagnostics, but a lot of the treatment and the ongoing management for people. What hasn't changed is people who are at the heart of it, people with their complex lives, their social and psychological problems, as well as the physical problems they come and see us with. The NHS is in quite a precarious situation actually. We've had a decade of reduced funding to the NHS compared to what we were getting used to, and the demands from our patients continue to rise, but also the number of things we can do for our patients is always increasing. New drugs are being developed, new treatments are discovered, and that's really good and exciting, but it all costs money. And as a society, we have really quite a difficult challenge in determining how much we're prepared to pay for that. I love the fact that our NHS is free at the point of need, and it's free for every citizen of this country, and I really want it to remain that way. But to do that, we've got to fund it properly. We were delighted to hear the announcement of the birthday present, if you will, for the NHS. That's good news, but it probably doesn't go far enough. It represents about 3.4% real terms increase in funding, and actually what the Institute of Fiscal Studies and other august bodies have said we really need to keep moving forward and to really transform the NHS is actually in excess of 4% extra a year. So there is a mismatch between those two. We'll absolutely do the best we can with the money we're going to get. That's great. But it's going to be difficult to keep pushing forward at the rate we'd like to in the current financial situation. General practice is under phenomenal pressure. The biggest one is actually a shortage of staff, a shortage of GPs, a shortage of nurses, and all the other staff that make up the team that deliver care in the community. So we need far more GPs, and there's been promises of more GPs in England, but also in the 4 other devolved nations of the UK. However, it takes a long time to train a GP, and while we're waiting for more GPs to arrive and be trained, we're trying to encourage more to come to the UK from overseas, and we're trying to encourage other allied healthcare professionals to come and work with us. That's pharmacists and physiotherapists, that's paramedics, people who haven't traditionally worked directly in the surgery before, but they're doing a phenomenal job, and we're so grateful for their help. It's a team sport providing general practice. Of course we need money too. We need investment in diagnostic equipment. We need investment in our premises. A lot of GPs in the country work in premises that are really no longer fit for purpose. And the IT that we're working with can be quite embarrassing. The number of times my computer freezes and stops working when I'm in the middle of a consultation. And of course we're very reliant on our computers for our records and our prescribing information nowadays. So all these things need to be addressed. It's not just one thing or another, it's all of them together. I'm delighted to see the new recruitment campaign. It's really enticing and encouraging, but it's mostly targeted at nurses, and that's fantastic. We desperately need more nurses in general practice as well as in our hospitals. And it's a great step forward, but I'd like to see a wider ranging campaign to encourage doctors to consider careers in general practice too, because I firmly believe that a great NHS needs firm, solid general practice to underpin it all. And we know that good general practice saves the rest of the NHS. We protect the NHS by ensuring that only those who really need it get passed on to secondary care. I think if people are truly struggling, that they need help, they need to cut down their hours, get help and look after themselves, because we can't give a good service to our patients if we're not healthy ourselves. But for people who are just frustrated by the current system, I would say there is cavalry coming over the hill. There are green shoots appearing. Money is starting to flow. If you can bear with it and take all the help you can get and protect yourself, I do believe we've got a brighter future ahead of us. Everybody wants this to work. Everybody wants the best NHS we can have. And I do believe that those in charge do understand that general practice underpins all of that.